So shoulder replacement is a treatment for arthritis in the shoulder. There can be many different causes of that arthritis, but the main symptom that the patients complain of is pain on the shoulder, particularly in movement, often difficulty sleeping on the affected side, and very often you get a grating sensation or even a grating sound coming from the shoulder, which is due to the bone rubbing on bone. I don't think you can have any operation without some discomfort afterwards. The anaesthetist that I work with, Dr. Anil Singh, is very good at what's called a brachial plexus block, which means once the patient is asleep, he injects local anaesthetic around all of the nerves as they come out of the neck. This provides really good pain relief for 12 to 24 hours after the operation, when we would expect the pain to be at its worst. Once that local anaesthetic block wears off, yes, there is some discomfort, but that's usually treatable with simple painkillers without too much discomfort. So I would normally see the patient in the clinic. We arrange for simple x-rays, which are usually enough to diagnose the arthritis. I do use a three-dimensional planning software tool, which basically builds a three-dimensional model in virtual reality of the shoulder. And for that, we have to get a CT scan done before the operation as well. Beyond that, it's purely a question of making sure that the patient is fit for an anaesthetic, so pre-op assessment in terms of chest x-rays, ECGs, and the like. On average, I would say it takes between just over an hour, hour and 10 minutes, up to maybe an hour and a half, or perhaps 2 hours for really complex cases. Of course, from the patient's point of view, there will be half an hour or so of anaesthetic time before the surgery starts, and maybe 3/4 of an hour or so once the surgery finishes. So the patient will lose track of time for 2.5 hours or so. Okay, so in addition to my anaesthetist that we've already spoken about, there's usually myself, one assistant, and the scrub nurse. And then, of course, there are the rest of the theatre team helping out in theatre. We usually operate with the patient sat up on the operating table because this helps prevent blood loss. The incision is over the side of the shoulder here, probably about that sort of length, to allow me to split the main muscle deltoid over the top of the shoulder, and then get into basically remove the ball part of the ball and socket of the shoulder and replace that with metal, and to replace the socket side with a plastic implant. There are different ways to measure success, of course. Most patients will get 95% pain relief. I would never promise anybody 100% pain relief, but certainly good pain relief for the vast majority of patients. In terms of movement, it's very rare that you get a shoulder replacement that will allow you to do that. Most shoulder replacements will allow the arm to go to this kind of level, but that's usually enough then to allow the patient to get the hand to the back of their head. So that's the sort of movement that we would be looking for after an operation, after a shoulder replacement. You can also measure success of a joint replacement in terms of how long it lasts. If you have a hip replacement or a knee replacement these days, most people would expect it to last for 15 years. Shoulder replacements haven't been around for quite as long as either hip or knee replacements. The development process hasn't been as extensive, and inevitably shoulder replacements haven't been developed to quite the same extent. So we would expect a shoulder replacement to last probably somewhere in the region of 12 years at the moment. Most people would go home either the day after surgery or possibly the following day, so 1 or 2 days in hospital. The anaesthetist that I work with, Dr. Singh, and I have been pushing recently in younger patients who are fit and well with no other medical problems, we have been able to get those patients to go home as a day case. This is something that's been pioneered in the US over the last couple of years. There are a few units in this country also able to do shoulder replacements as a day case, but I think we're the only one in the West Midlands that have done this so far. It is still in its infancy, and we've done 7 patients who we've been able to get home as day cases, including one patient who had a day case shoulder replacement last summer, and we're so pleased with the whole thing. About 3 weeks ago, she came back and had the second side done, also as a day case. So patients would be in a sling for about 6 weeks after their surgery. During that time, the physios will encourage you to gently get the shoulder moving, building up the range of movement slowly, and also the strength. We'd expect you to get rid of the sling at approximately 6 weeks, but there will still be some work with the physios for at least another 6 weeks afterwards. So really, one would expect 3 months or so of work with the physios. In fact, patients tell me that the shoulder does continue to improve, certainly for 6 months after the surgery, and there may even be a small amount of improvement in terms of movement and strength up to a year after the operation. So I've already mentioned that it's unlikely that you get full 180 degrees movement out of a shoulder replacement. Abduction to this kind of level is what we would be expecting, and similarly forwards to maybe 140 to 150 degrees. We would expect you to get some external rotation, twisting outwards like this, but unfortunately after a shoulder replacement, it is quite unusual to be able to get the hand all the way behind the back. In terms of strength, certainly patients get more strength after a shoulder replacement than they had beforehand, because we've got rid of a lot of the pain. But I wouldn't really expect patients to be lifting heavy weights afterwards. Depending on what type of shoulder replacement it is, and depending on how fit the patient was beforehand, there are certainly reports in the literature of patients getting back to playing gentle tennis and indeed playing golf after a shoulder replacement. But I think it does very much depend on the motivation of the patient and how bad the situation was before we started. So shoulder replacements generally will last in the region of 12 years. That's the data that we've got at the moment. Shoulder replacements are undergoing constant re-evaluation and further design process. We would hope that the implants that we put in today will last longer than 12 years, but obviously 12 or more years have to go by before we can definitively answer that question.